We receive a lot of questions about the differences between dentures and dental implants in regards to comfort, and we're here to answer those questions today. So the first question is about how dentures will feel in my mouth. Also, how would dental implants feel, or what about zygomatic implants? Well, I will say that for most patients, dentures are somewhat loose. They literally are just sitting over top of the gums. They're not anchored into the bone at all. Dental implants, on the other hand, do have a portion of the implant that's anchored into the bone, just like the roots of a natural tooth. So I would say that dental implants feel much stronger and more stable than what dentures would. The zygomatic implants, honestly, I would say that most patients can't tell the difference between a traditional sized implant and a zygomatic implant, which is anchored into the cheekbone. Really, it's about the foundation that is supporting the teeth that are placed on those dental implants. And that's the biggest difference between dentures and dental implants. What is it like to chew and eat with dentures versus chewing with dental implants? In terms of chewing with dentures, we always learned that chewing with dentures, the patient is supposed to try to split equal amounts of food and chew on both sides at the same time. If you've ever paid attention to when you're eating, you can always have a favored side, right or left, generally, in your natural teeth. However, in dentures, in order to avoid tipping the dentures and loosening them, the patients are instructed to eat equally on both sides at the same time, which is actually quite a difficult feat. In terms of chewing with dental implants, however, the teeth that are supported on those dental implants are screwed into the actual dental implant. The dental implant is also anchored, supported by the bone. And so it is the most like natural teeth. In order to produce forces to chew through your food, the dental implants have the ability to do that just like natural teeth. Next is, how do dentures affect my speech, and can dental implants make my speech sound funny? Well, to answer the question, I guess dentures probably would create differences in your speech, because the denture is actually a piece of plastic that extends across the roof of the mouth. It also extends up underneath the lip as well, and so that's a lot of bulk of plastic within the mouth that can certainly affect the way that patients speak. In terms of the teeth or prosthetics that are anchored into the dental implants, those prosthetics are very much slimmer and more similar to natural teeth, and therefore, once patients have adapted fully to their dental implant supported prosthetics, they have very good speech, very similar to what they had in their natural teeth, although there can be expected to have some adaptation period while they're healing. What I mean by an adjustment period is that oftentimes patients come in with a fairly full set of teeth, and so they're used to speaking with their natural teeth that they've gotten to adapt to over pretty much their entire life. When we take all of those bad teeth out and replace them with a new set of teeth, there's oftentimes an adaptation period that requires the patient to be patient and allow themselves to learn how to speak with their new teeth again. Oftentimes, patients do this very rapidly within the first couple of weeks. Other times, patients need a little bit longer. What's the daily cleaning or maintenance routine for dentures? And what is the daily cleaning and maintenance routine for dental implants? Well, I would say for dentures, it can be actually quite disconcerting for patients because you're supposed to remove the denture entirely from your mouth every night, brush it, and then place it into a cleaning bath and allow those to sit overnight. So you'd be without teeth for the entire overnight period. In terms of the teeth that sit on dental implants, these are actually screwed into your dental implants, and so they remain in your mouth just like your natural teeth would. You actually brush them and clean them just like you would natural teeth. However, you get a buy on the flossing and don't have to floss between each of these teeth. We do typically recommend utilizing a water pick to help you clean underneath this fixed bridge. However, they're very much similar to what your natural teeth are in terms of maintenance on a daily basis. There is still a recall or a hygiene visit that's required to make sure that you're maintaining your implants appropriately. We typically recommend about a 6-month follow-up visit to be able to remove the teeth entirely and have them cleaned in the ultrasonic cleaner. Will dentures last my whole life? Will dental implants last my whole life? That's a good question. I will say that the dentures are typically recommended to be replaced at the maximum every 5 years. Many patients go much longer than that, but they do start to wear out. Both the tooth portion that you're chewing with as well as the gum portion that sits on the gums tends to wear out and require refabrication. In terms of the dental implants, these prosthetics are very rigid. They're made of zirconia, and this material is similar to what a dental crown would be made of. It is very long lasting and very rigid. It's very unlikely to break. And so it certainly is reasonable to consider these for the rest of your life. With the dental implants that are anchored into the bone, with proper maintenance and ensuring that they stay clean, they certainly can last an entire lifetime. The prosthetics that go on top of the implants also are much more rigid than a denture and very rarely would wear out. These certainly also can last you a lifetime. How often do you need to have dentures adjusted? Or how often do you need to have dental implants adjusted? Good question. The dentures themselves actually are technically supposed to be adjusted several times in the initial period to allow you to adapt to them and make sure that you don't have sore spots along the gums, since the dentures are literally a piece of plastic that's sitting over top of the gums and very quickly will cause sore spots if there's an extra bump on the inside. In terms of the dental implants are not adjusted themselves. The dental implants are the portion that's into the bone and begins to heal from day one. Once those implants have healed fully, there's really no adjusting of the actual implants themselves. In terms of the prosthetics or the teeth that are supported on those implants, particularly in the temporary periods with our New Teeth Now procedure, there are some adjustments that are made in order to make sure that it's safe for the implants while they're healing, and then again once we get you into final restorations. The final restorations we tailor to your needs in terms of both aesthetics and function, so there can be some adjustments, but once those adjustments are made, your final teeth should last you almost your entire life. Is getting dental extractions a different experience for dentures than it is for dental implants? That's a good question. The actual extractions themselves are very similar. However, I would say that it's much more common for patients that are going to be getting dentures to have their extractions done just under local anesthesia, meaning that you're just being numbed up, you're still aware of all the things that are going on, including all of the noises and irrigation or fluids within the mouth. Whereas for dental implant placement, if you're having a full arch of implants placed, it's generally done under a general anesthetic. Here with us at New Teeth Now, that means that you're completely asleep and not aware of anything that's going on at the time of the procedure. And last but not least, what's the best option for overall oral health? Dentures or dental implants? Well, definitely that's an easy one to answer. Full arch dental implants here at New Teeth Now will be the best option for replacement of your natural teeth. Dentures will oftentimes cause you to lose bone within your jaws, as well as cause you to use a modified diet, which is not as good for your overall health. Full mouth dental implants from New Teeth Now, on the other hand, will give you the best comfort and function as compared to your natural teeth. These are all great questions. Keep sending them in, and thanks for watching.